Like yesterday when we spoke, you mentioned that you feel that a lot of sort of very pro-freedom libertarian types have sort of complained about rights and freedom being surrendered and without considering like the experts that they're questioning. And I thought a lot about that. Like I really did. And I was just trying to think, I was like, about who I should go to to listen to and trust on this issue. And I was thinking about why I have lost trust in certain individuals, some of the people on Sage and whatnot, that I just don't know who to listen to anymore. I just like I want to just give like a couple of examples as to why I and people I've spoken to have kind of like are reluctant to listen to some of what people are saying, just so I can get like express my point better. So like last year, a couple of things that the World Health Organization said at one time or another to retract or not retract, where they said that lockdowns were not a long-term option because of the other side effects of them. They said that at one point, asymptomatic spread was statistically negligible and outdoor spread as well. And the British Medical Journal said that. But then another study, they didn't. They said that vaccine passports were not a good idea. And then in terms of like who we should listen to, there's been a lot of, promotion of people saying, okay, we need to wear masks and lock down. And I'll listen to that. And then you hear people like Dr. Sunatra Gupta from, I think it's Cambridge University, and a lot of people who signed the Great Barrington Declaration, as much as that was kind of corrupted by random people just signing it. Like there was still like legitimate doctors signing it, who were sort of opposed to the ideas. And I guess I'm kind of lost in this mess of who to listen to. Like, how would you suggest that someone tries to cut through that and figure out like where we should place our trust?
It is really, really difficult, like you say. And I think when you've got a situation like this where the information is moving really quickly, not everyone agrees, and potentially lives are at risk, it's really tough. And I was thinking about it a lot as well, Josh. And I think actually in my role as a medical professional, it's probably easier for me to like sift through all this sort of thing and then maybe ask the questions in my head about like, well, what's this person's background and what university are they associated with and who's funding them and all the rest of it. And to a lot of people, they maybe aren't used to reading medical journals and it's a different situation. So for some of the people who are getting really cross on Twitter about masks, for example, that, no one's going to be like, I don't believe that most people are genuinely going to be bad actors here. I think people are probably trying to absorb information and try and take the information they feel to be the most believable that they're absorbing. I think the thing that's really hard about this crisis is that it's political and it's been politicized. And when you've got people making political decisions, and medics or scientists are kind of inputting information into that, but they're doing so in an advisory role, not in a kind of executive role. Sometimes even the stuff that doctors and scientists have been suggesting to the government hasn't been listened to. And so, we look to our leading medical figures like Chris Whitty, for example, or Professor Van Tam, who I respect both greatly. I don't necessarily think the government always listen to them. And so it's very difficult, when you're listening to the daily briefings and stuff, thinking like, well, is this truth? Or is this something that they have inputted to? Or is this something that the government have put out without listening to doctors? It's really, really hard to figure it out, isn't it? I suppose I don't think doctors always get it right, and don't think scientists ever get it right, because we are humans as well and we're learning. But what I have found really interesting is that people have become trusted voices who I'd never heard of before. And I find that really interesting, particularly on Twitter. And I think there's certain leading figures who I would now turn to as kind of sources of fact, whose names I didn't even know before the pandemic. So from a personal perspective, I try to listen to public health experts who've got a lot of experience thinking about diseases that spread around. I try to listen to epidemiologists and virologists who work in the public sector, because they don't have any other reason, you don't have any reason to be telling you anything that isn't based in fact. I think what becomes difficult is if you start listening to people who are being funded by or sort of supported by any other source. So I get worried about doctors or experts who who you can tell are being supported in doing something. So the Great Barrington Declaration is the absolute epitome of this, isn't it? There was some eminent scientists and doctors putting forth a view, and yet it was all a bit murky about who's funding this and what's the aim of this project. And I found I had an awful lot of questions about that.
Yeah. So you mentioned that you had like some people that you would have turned to that you haven't that you didn't know before the pandemic. Like, do you want to give some examples there? I'm keen to look.
Yeah, absolutely. So Professor Tricia Greenhall at Oxford, who's a public health professor, she's been doing some amazing work. Deepti Gurdasani, who's an epidemiology, she's a lecturer actually. She puts together really great graphics. Gabriel Scally as well. And they regularly put out threads on Twitter, for example, which I find are really informative. There's also the Indie Sage group, which I don't know if you've been following, but that's a group which mirrors what Sage are doing, but I suppose they're doing it independently. And so there's the sense that the politics from the government aren't infiltrating the messaging.
Okay. Yeah, it's the issue being that, like, we as you said, like, people are humans, and I honestly think part of the reason that everyone's gone so crazy about it is because like, we lack. There was a great quote from Jordan Peterson, actually. They were talking about like our retreat into digital communities and how it leads to acute paranoia because of the ability of an online community to hyper select its own members. So, like, as a psychiatrist, do you think that that's got like any merit, that we've all become like a little sort of locked in our own bubbles because of that, and they're unwilling to kind of consider different views of things? Because like, there's honestly one thing I've become really concerned about in the last few months, is that, say we have like a public inquiry, which I 100% think we should have post-COVID, and whatever the outcome, whether it shows that perhaps the lockdown should have been more targeted at elderly people, or perhaps that government should have locked down sooner, like, whatever the outcome is in hindsight, that whatever happens, that there's minimum 30 to 40% of the population that will never accept that they were wrong on this. Is that like something like, from a psychiatric point of view, is that something that you'd consider a problem, or potentially a problem?
I don't know if I'd consider it from my experiences working in psychiatry, and I haven't worked in psychiatry for a year now, but I've been doing an awful lot of work online, and so I've, like yourself, Josh, I've probably been watching the way people behave. I do think that we're becoming more entrenched in the views that we have, and the things that we see online tend to reinforce the beliefs that we already have. And so unless you're someone who actively goes out trying to create for example, a Twitter profile where you're hearing from both sides of different arguments, and you do that consciously, which some people do, we try to surround ourselves with things that make us feel comfortable, or like we're in the right, as you say. And when you get situations of crisis like this, where people's lives are being lost and livelihoods are being lost as well, I think that probably reinforces those feelings even further, that there's a sort of us versus them mentality about things. And I don't think it's just about COVID, is it? Like you say, Brexit has created a country divided, hasn't it? For several years, we're quite used to feeling that way now. Like there's two camps, and which camp are you going to sit on? Rather than kind of keeping an open mind. So it's worrying, definitely. And I think politics is seeing this trend generally, isn't it? And it's getting worse on social media.
Yeah, I mean, that's the whole point of my book, is that social media is making those divisions worse. So I enjoy being right, but not at the expense of our country. But I guess like my takeaway would be to try and consider that you could be wrong. That's like my whole thing, and I find that it's fun trying to watch people pin down where I stand on issues, because I talk to people from so many different points of view and agree with them on a lot of things. So it's always funny watching people try and pin down where I'm at if they like look at the people I follow on Twitter, because it's everyone from like pure conspiracy theorists to like the the most left wing of woke people, and they can't pin down where I'm at, which is fun. So if you had to like give some takeaway for people at the moment in terms of, like, you know, either trying to remain positive or, you know, wanting to show support for doctors, or like what would be the message that every doctor is trying to pump out at the minute?
Well, I think we're trying to spread awareness at the moment about what's going on in the NHS. We had a big meeting about this yesterday, actually, about NHS prioritisation in particular, of how we all need to kind of come together and look at what's happened so far in a kind of blameless way, because I don't think any of these problems in the NHS is down to one villain who's kind of swept in and ruined everything. It's happened over a really long time period. Lots of decisions have been made, some of which have been made for sensible reasons and haven't worked out brilliantly. There's been a lot of change. You know, there's all kinds of reasons why the NHS has found itself in the position it's currently in. But I think what we need to do now is to look at the situation we're in, look at the timeline of events that have led us to this point, and then have a really honest conversation with lots of different viewpoints from different political parties about what do we actually want from the future of the NHS, and therefore put a plan in place to allow that to happen. And if the Conservative government do want to privatise the NHS, and that is their aim, then I would certainly appreciate it if we all knew that, and we knew what they were going for, so that everybody could lose this sort of this sense that we have to save the NHS and sound a little bit conspiracy theorist about the whole thing.
Thanks so much for listening. If you enjoyed the show, please subscribe, follow me on Twitter, or sign up to our mailing list. Thanks a lot to our sponsor, ExpressVPN, the #1 most trusted VPN. Get lightning fast connectivity with servers in 160 locations across 94 countries. Keep your browsing privacy safe with ExpressVPN, and get a 35% discount on 12 months of ExpressVPN when you follow the link in the description below. Don't forget, my book is now out and available to order on Amazon and on bookshop.org. That's Brexit, the Establishment Civil War. And most importantly, thanks for listening. We'll see you next time.